Hi everyone, I'm here to talk about something that's near and dear to my heart, and that's how we feed our children. Most people would say that you feed your child with a fork and a spoon, or by mouth, but what if your child could not get adequate nutrition that way? How else would you feed your child? So that's what I'm here to talk about today. This is Cadence. This is my child. She's 3 years old. She was born with a rare birth condition called Pierre-Robin sequence. And it involves 3 sequential symptoms. Microganthnia, which is a small lower jaw that pushes on the airway. Glossotopsis, which is a bigger tongue that obstructs the airway. And a cleft palate, which is the tongue has exceeded up to the roof of the mouth and the palate has no longer closed like a normal child's would. Cadence's PRS was so severe that it has led her to need the use of a gastronomy tube, which you can see in her belly right here. And this is how we feed her because she is unable to get adequate nutrition by mouth. So today, with the help of Cadence, I, Stephanie Aliff, will demonstrate how to feed her via a gastronomy tube by gravity. The first thing you're going to do is collect all your supplies that you need. You will need a 60cc syringe. I don't know if you can see it. And you can get this through any medical supply company. You'll also need what's called an extension set. And again, you can get this through any medical supply company. And this directly inserts into the gastronomy tube. And you will also need formula. Cadence uses Pediasure with fiber. She receives 3 of these a day via gastronomy tube by gravity. And I'll explain further in the video what gravity is. So now that we've collected all of our supplies, we'll get ready with the feeding. So the first thing that you're going to do is you're going to clean your hands. You can either do it by soap and water or just some hand sanitizer. Anytime you're going to touch a patient or another person, it's always best to clean your hands. This is not a sterile procedure. So once we've done that, we'll get started into the cleaning. Cadence, you want to clean your hands? Okay, Cadence wants to clean her hands. Okay. So now that we've cleaned our hands, we're gonna start with the administration process. So bear with me. We're actually doing it in real life with a real toddler. So the first thing that you're gonna do is you're going to take this extension set, and it has a little clamp. So if you do not clamp it, the fluid that you put in it will come right out. And unfortunately, that's happened to me many times, so it's just a learning experience. So the first thing that you're going to want to do is clamp the tubing to ensure that nothing that you put through it is going to come out until you're ready. So the next thing that you're going to do, this 60cc syringe has what's called a plunger in it, and that helps get the formula down. If anything's clogged in it, it'll help ease it down with a little bit of pressure. So you're going to want to take the plunger out, okay? And you're going to want to set up the extension set with the syringe. And it's really easy. It just has a tip on it and it fits directly into the syringe, like so. The next thing you're going to want to do involves the actual patient. So we'll lift up her shirt a little bit, okay, like that. And we're going to open her gastronomy tube, and she has what's called a Mickey button. So it's almost flush with the skin, and it looks like a little button, which is really cool because it's very discreet. So we're going to open it up, and these extension sets just have a little piece that you just plug right into the Mickey button. And then you turn it until it's locked in place. So it ensures that it won't come out. The next thing that you're going to want to do is hold the syringe upright and continue, like I said, to keep that clamped, because any fluid that you have that's going to go in it will come out. And now that it's especially hooked to the gastronomy tube, it's going to go into the patient. So you want to ensure that, you know, you're ready for that fluid to go in. So until you're ready, keep it clamped. The next thing that you're going to do is you're going to shake the Pediasure and ensure that all the formula and the minerals and everything in it is combined together. And then you're going to open it up, of course. And then you're going to just start pouring it in very slowly. And sometimes it can be messy, it can come out, or if you fill it up too much, they can cough. So, and as you notice, it's not really going through. So that's when you unclamp it and the formula just starts going through. And it's really easy. Now, when you start feeding your patient or your child or whomever you're going to feed, you want to ensure that they're sitting upright. If they're laying down flat, they're going to be at risk for choking or what they call aspiration, where the fluid that you're instilling into their gastronomy tube, which goes straight into their abdomen or their stomach, is going to back up and go into their throat, and then they can choke. So you always want to make sure they're sitting upright. Coughing is normal. They're going to cough. They can eat while this is happening. You know, they can do anything while you're feeding them. So it's pretty cool, and it's a really easy process. So as the formula goes down, you just add more. And Cadence's feeding process is by gravity. Now, sometimes these gastronomy tube patients can either be by gravity or by feeding pump. And the feeding pump controls how much goes in per hour. And Cadence's, like I said, is gravity. So, which means we give her a big can of formula, just like this, and gravity just lets it go in. So the higher we put the tube, the faster it's going to go in. And the lower we put the tube, the slower it'll go in. I've noticed with Cadence's situation, if we let the formula go in faster, she sometimes gets an upset belly and nauseous. So it's really important to have it at a steady rate, not too fast, not too slow. So it's going in, and it doesn't hurt the patient, and Cadence is pretty used to it. She's been getting these tube feedings since she was about 5 months old. So she's at the point where she could probably feed herself. And then you're going to complete the feeding by however much the doctor has prescribed, which is, for Cadence, it's the entire can 3 times a day. And then once you're done, which I'll show you, once you're done, you always want to make sure, sometimes if you pull on it, it hurts, and that kind of startled Cadence. She's being silly now, but now that the feeding's done, you want to make sure that you clamp the clamp on the extension set past where the formula goes. And that is to ensure that the formula does not fall outright once you've undone it. So we have finished the feeding, and it's really simple. You're going to take off the syringe, and then you'll lift up her shirt, and you're going to turn it to the unlocked place, pull it out, and Cadence knows how to plug her tube back up. And then I always suggest these are reusable. We get about 4 of these extension sets a month and unlimited syringes, but we reuse them. So just rinse them out with hot water and a little bit of soap, and you can reuse them, and it really saves. So the next step I would do is I would go to the sink, clean it out, and let it air dry. I would again wash my hands. Cadence is washing her hands too, and then your procedure is all done. So many people are intimidated by medical procedures just like this one, which was feeding by a gastronomy tube. But as I showed, it's a very simple procedure, and it doesn't hurt the patient. It's really easy, and it's something that Cadence needs to live by. So, you know, it's really easy. If you have confidence in yourself and just continue to do it more and more, you'll do great at it. I hope these steps helped, and I hope you enjoyed my video. Thank you.